The Great Depression devastated public and private funding for healthcare. Hospitals, especially in rural areas, had to stretch every dollar. Dr. Sarah Bowen represents a generation of practitioners who embodied resourceful innovation. She built improvised nursery and clinical equipment using scrap wood, kitchen items, and reused parts. Her work was not only technical, but spiritual and communal, often embedded in church run rural clinics and women's mission organizations. This was a time when medicine and morality were deeply intertwined. To care was to serve, and to serve was an act of faith. Bowen's improvisation aligns with the roots of clinical engineering, where maintaining care with limited means required creative, technical judgment and moral clarity. In today's clinical environments, the legacy lives on. When supply chains break down or budgets shrink, engineers step in to preserve care through adaptation. The Great Depression was the worst economic downturn in U.S. history, and it crippled healthcare systems, especially outside of urban centers. With mass unemployment and poverty, people had limited access to doctors, hospitals, or even basic sanitation. The New Deal programs under President Franklin D. Roosevelt began to expand public health support, but rural areas lagged behind in infrastructure and staffing. Many community clinics and religious institutions filled the gap with volunteerism, donation based care, and a deep emphasis on practical service. This context explains why frugality, ingenuity, and mission driven healthcare became so central to the next generation of care professionals like Dr. Sarah Bowen. The decade set the stage for how resourcefulness became a clinical skill, not just a financial necessity. During the Great Depression, Dr. Sarah Bowen exemplified frontline ingenuity by creating a functioning nursery from everyday items like drawers, boxes, and wooden planks. Rather than wait for institutional support or funding, she repurposed what was available, demonstrating that care could begin with creativity and resolve. She transformed basic materials into tools for safe obstetric care, addressing maternal and infant needs in underserved areas. This was engineering by necessity, problem solving in real time, based on patients' needs and environmental constraints. Bowen's work offers an early example of patient centered, field driven engineering, an ethos that strongly echoes in modern clinical engineering practices today. In many rural and underserved communities during the 1930s, churches served as the backbone of local healthcare, often providing space, staff, and moral support for small clinics. Dr. Bowen's improvisation wasn't an isolated act, but part of a broader faith driven service ethos. Repurposing everyday items was framed not only as necessity, but as an expression of humility and compassion. Clergy and congregations frequently offered both material resources, beds, rooms, volunteers, and spiritual encouragement, linking physical caregiving to a deeper sense of stewardship and grace. This melding of faith and medicine created a model where healthcare was seen as communal duty, reinforcing trust and solidarity long before formal public health programs reached those areas. For modern clinical engineers, this legacy reminds us that technology and processes don't stand alone. They gain meaning within the social and ethical fabric of the communities they serve. Clinical engineers, much like Depression era healthcare workers, are frequently tasked with doing more with less, navigating limited budgets, aging equipment, and unpredictable environments. There is a shared ethic between past and present, adaptation over replacement. Whether it was Boeing building a nursery from drawers or a modern tech fixing a machine with scavenged parts, the core skill is resourceful problem solving. Repair and usability aren't just technical issues, they're human centered. Clinical engineers must ensure that devices are safe, intuitive, and accessible, especially in high stress or under resourced settings. Ultimately, this legacy highlights that clinical engineering isn't just about machines, it's about honoring care by making tools work where and when they're needed most. Modern stewardship, whether in urban hospitals or rural clinics, inherits the values of ingenuity, humility, and service, values modeled by pioneers like Dr. Bowen. The 1930s showed us that crisis breeds innovation, but not all innovation requires high tech tools. Sometimes it's about making the most of what's available with compassion at the core. Improvised care in the Great Depression revealed that healthcare is both a science and an art, grounded in ethics, creativity, and service. This legacy lives on in clinical engineers today. They bridge technology and care, ensuring that equipment works reliably even under strained conditions. Whether in a bustling hospital or rural clinics, clinical engineers inherit this tradition of compassionate problem solving, a reminder that every fix is in service of human dignity and healing.